buccal fat pad, buccal fat pad of Bichat. There's all these different names, and I think last time we spoke I said the proper pronunciation is buccal fat pad, but since everybody calls it buccal fat pad, let's just call it that. Buccal fat pad surgery is obviously taking off in popularity, not only in my practice, but I think just nationwide. It's a very popular procedure that, despite my videos, continues to encourage fears of facial hollowness and the fact that, you know, with weight loss and other things in the future, the face becomes more sunken in and hollowed out. It's an important concern to have for sure, but I really want to reiterate the subtlety of this procedure. It's not a major face shaping or reshaping procedure. It is really subtle, and in a carefully selected patient, we are only taking out the portion of fat that contributes to facial width or a visible bulge. It's not a destabilizing procedure or anything like that. In fact, the results are beautifully subtle, and this is why I like the operation so much. It's like fat grafting. It's not an Instagrammable operation. You'll see in the results yourself that somebody looks better afterwards without like a measurable, visual like change. If you look at them before and after, it's like you gotta look for a second to see the results. And we'll show you an example of the patient featured in this film. But this fat pad, it's pretty extensive, and everybody says, do you take all of it out? The answer, as I mentioned before, is yes and no. I do take out all of the body that's like visible cosmetically in the cheek, and that will give you a little bit of a narrowed facial appearance. But we don't, you know, dissect all the way up to the temple, and some people feel pulling and things like that, but really, the portion that is removed is the cosmetic portion, and I can titrate from there. Sometimes people come in and say, in fact, for every patient who says, I think too much has been taken out, and I can think of one, there are probably 10 patients who come to me for a revision buccal fat pad surgery to remove more because they feel like the result is too subtle. In my own practice, I see the same thing. It's a beautifully subtle result. Check it out.